And then last but not least, Gözde Susuzlu-Briggs, Data Saves Lives Coordinator, European Patient Forum. And I said nothing about us without us. And so your topic is raising awareness and engagement on health data with Data Saves Lives. Please, the floor is yours.
Hi, everyone. I'm just going to see if it's here. Yeah. So let me start first say Data Saves Lives is actually an initiative that's been secretariat as European Patients Forum. This is an initiative that's been running for the last 3 years, but it was initially started in the UK, and we took over to kind of build it to be an EU level initiative. So what is Data Saves Lives? It's a multi-stakeholder initiative, although it's EPF, that's the secretariat. We're trying to run this as a multi-stakeholder initiative to build dialogue between different communities, not to stay in their silos, but kind of work together. So we're trying to increase awareness about the importance of health data and improve the understanding of how it's used and what it is, and actually remove the stigma about health data use and its benefits, but at the same time, the potential risks. So we're really trying to stay transparent in this initiative. We have also run quite a few AI-based work at the EPF level, but at the Data Saves Lives level, we are still trying to get the basics of health data because it's a big topic. It's so large that coming to AI would already be an intermediate level of discussion, because we know there is a lot behind it, and big data important and health data is important for AI. But to be able to reach the patients' communities about the AI topic, we still needed to investigate further about, of course, health data topics. So what we have done in Data Saves Lives, we realized it's very important to build trust. So to be able to build trust, we keep on saying that people, patients, citizens first need to understand what it is, what's health data, what's behind it. For that, we started to build a toolkit for our member organizations. That was our first reach. The easiest reach for us was the EPF members, to be able to build this initial version of our toolkit to kind of help them a little bit use the campaign that we're using at EPF for them to use it in their own national settings or in their organizational level. Of course, when you give someone a toolkit and say, there you go, use it, it doesn't work. So we've noticed that because it would just stay in a bookshelf or even in digital version right now. So we thought of building further through the EPF Congress as well. We started to have workshops. We did also a pilot patient council to be able to go through this toolkit. And the outcome was we need to bring people together, and they need to really sit together, do workshops to be able to use whatever means it is to build this campaign. So what we decided to do is build a training bootcamp to start this year already. In the next 2 weeks, we're going to start so in Prague, we're going to have our first bootcamp. We're bringing actually the EPF members, 20 of them, as the ambassadors, and we have also trainers. And for this first bootcamp, we are planning to open the concept of what GDPR is. European Health Data Space is, but also try and help our members explain it to their own members, these topics that are simplified, not too scary, but at the same time they can ask questions about. And then, of course, talk about the challenging questions as well concerning their health data. What are the challenging questions our members are having right now from their own community? How can they address those, but also be transparent, not to hold aside, but kind of build it together with their own communities. And so this is going to be our first one, we're hoping. We're going to continue in the next year as well, more boot camps. And through this, just gonna, whoop. Come. There you go. So what we are going to continue doing is, of course, social media. We're using a lot to be able to communicate further to not only our members, but also a larger community, the multi-stakeholder community. We're holding also extra workshops online, and we are planning to do face-to-face ones, depending on how it's going to be possible in the coming years, to continue the campaign further to actually grow data saves lives in the national level, so that we could have further data saves life hubs in national settings. So just to let you know that Germany, for example, is our first mission right now, that they are taken on board data saves lives, and Ministry of Health is actually supporting the initiative. So it's going to be our first step, and we're hoping to grow more in the coming years with different national settings. And that will be my side.
Thank you, Gözde, and this was very concise and up to the point of presentation. So if you don't mind, I'll move up directly to posing questions. At the same time, so please raise your hands as I ask Gözde from you a bit of the same question. So do you think that the big data is well preserved and is better used for the patient's interests beyond 5 years from now?
It has to. I don't think there is any other option, and it has to evolve to that direction, because we all know when you lift up the fear and lift up the stigma and the details about this is a must. We have to move towards that direction, because diseases are there and patients are suffering. And it's just, and also citizens. I mean, we're all patients after all, we keep on saying that.
Mm-hmm.
So in one way or another, it has to, and shouldn't wait 5 years even, probably. Thank you.
That's important, and thank you for underlying the fact that we are all patients at some part of our lives. So this is not being healthy part of the population and patient part of the population. It depends about the time and the need. So we need to take that into account.